Greetings, rabble rousers. My name is Jessa McLean. Welcome to Blueprints for Disruption, a weekly discussion dedicated to amplifying activism across Turtle Island. Together, we will examine tactics, explore motivations, and celebrate successes in disrupting the status quo. This podcast is a proud part of New Left Media. So I don't think at this point there's any disputing that public health care in Canada is under attack. And really, it has been for years. And even though we constantly seem to pride ourselves in the idea that healthcare is some sort of inherent Canadian value, whatever that is, we've not done a whole lot to defend it, to make sure that it's not just another one of these public services sold off to the highest bidder. With our resources, Canada could have one of the most robust healthcare systems in the world. We've chosen not to. We've chosen defunding and delisting services instead of expansion and true universality. Heck, even the NDP is happy to introduce means testing into healthcare. Neoliberalism of all colors has eroded our healthcare for decades now, and this attack on one of the most fundamental public services we have has largely gone unnoticed by the public. Until now. Open talk of privatization, seeing ERs close, and the massive nursing shortage has alerted the masses, I think. And as oblivious as many have seemed to be, there has consistently been a group of people fighting back, perhaps unbeknownst to us. Health coalitions. Health coalitions have been on the front line pushing back since the inception of our public health care. And there's never been a more critical time, honestly, to amplify this work. So this episode will shed light on what they are, what their mission is, and I think it reveals what's standing in their way. Let's hear from my next guest who knows all about these coalitions and just what they need to do to save public health care. All right. Thank you for joining me. Peter, please introduce yourself to the audience.
And greetings, Jessa, and your listeners on New Left Radio. My name is Peter Bergmanis. I am the co-chair and founding member of the London Health Coalition in London, Ontario. We're part of a broader band of like-minded people under the coalition in Ontario known as the Ontario Health Coalition, which itself is then under the broader pan-Canadian group known as the Canadian Health Coalition. Many of us come from all walks of life. In Ontario, we have some over 700,000 members, largely all volunteers, and we all have this passion for the defense of Tommy Douglas's vision of a universal, accessible public health care system. And more than that, we not only want to defend it, we wish to see it expand and grow.
So 7,000 members, was that just for the London Health Coalition?
No, sorry, that was 700,000 members in Ontario. The
Thank
London
you.
Health Coalition has approximately 200 active members, but guarantee you there's about 10 times more than that are sympathizers.
And ready to activate when needed.
Exactly. And it's nonpartisan. I have to emphasize that, which is part
Even though even though we dropped Tommy Douglas's name already, we are nonpartisan, but we are definitely not. You're definitely not non-political, right?
We're highly political because healthcare is highly political. As much as some of the commentators like to say, take politics out of it, we wouldn't have a public healthcare system without politics. And Medicare was brought in by all political parties. So that's why we can easily say we are nonpartisan, because it was introduced by all political parties. And, any threat, irregardless, left or right to it, we will be very vocal critics of whatever policies threaten it.
Now, I would have thought that the Health Coalition was made up of healthcare workers, but you were saying these are volunteers from all walks of life. Is it predominantly healthcare workers? Who are you mostly speaking for?
Healthcare workers generally, and I'm personally come from a healthcare field. I was in healthcare myself for about 40 years. about 30 of those years I spent in the operating theatre at St. Joseph's Healthcare in London. But apart from myself, there are certainly nurses, there are certainly physicians, other clinicians, techs of all manner, from diagnostics to pharmacies, teachers, social workers, farmers, you name it. They're all people who have the one common element, which is their unabiding and unabashed love for universal public health care.
How do you guys keep how do you sustain your work? So I guess that's my roundabout way of asking who funds the work.
Well, it's largely we'll talk on two different levels here. It's largely funded by individual donations. That's the model that we rely on heavily. There is a working staff based in Toronto, which is where the director of the Ontario Health Coalition resides, and they do get a salary. Um, Organized labor is very instrumental in ensuring that there is an ongoing flow of funding to make sure that there's stability in our source of funding, but it is not our sole source nor the majority source. It is a good structural advantage to have labor, and labor has been always involved in the services that are public good, and so they're an ally. And so the Ontario Federation of Labor here in Ontario is an ally, and it also helps support. Local funding comes from volunteer donations from various groups, including labor councils, but they're like usually one-time things and are much appreciated in the ongoing work that we do.
Now, can I imagine are these coalitions everywhere? I know that there is the larger national coalition, but is this very common for all regions to have, even if it's small and mighty force?
Well, really, it you have to remember it was founded literally. The Canadian Health Coalition was founded in the early '80s by Tommy Douglas, because at that time, at a convention, he announced that we have to be alert to the threats to the public system that his vision had created and that had been brought into Canadian law and life throughout the '70s. And even then, the threats were there. And so he said, we need to establish coalitions throughout the country. And very much so, we have grown and expanded over the last 40 years to include every jurisdiction. Now, I'm not as familiar with the territorial governments, but I'm almost certain that, like in larger provinces like ours, you would have many, many coalitions in many communities. And the London one's been around over 20 years now. So, and as I say, we probably started with in Ontario with less than 500,000 members. Now we're almost up to 1 million. So we know we've been expanding in communities because the word does get out.
The timing of it, it's not ironic that Tommy Douglas would have foreseen the need for these coalitions and then to see them expand alongside the expansion of austerity, right? So I imagine the busier you get, the more you grow, because I think it's more apparent to Canadians that there's a need to defend it. Before we went on air, I want to go back to that comment you made that perhaps some of us are a little naive in the security of our public health care. You agree with that? Is that part of your role, just making sure folks know that there's a fight to be fought?
Absolutely, is it's the reason for our existence is to ensure that there's a healthy public debate around all healthcare issues that take place. And Tommy Douglas foresaw that many years ago, like obviously bringing it in and giving it birth in Canada was a long struggle. It didn't happen overnight. And he knew that the very same forces that we thought we had staked down were going to again attempt again and again. And like 2 generations later, here we are in Ontario with an broadly unpopular government that is actually threatening the very existence of universal public health care and portraying their outdated private ideas as if they're a new innovation when they're so dinosaur that that's why Canadians got rid of private delivery of healthcare over 60 years ago. But money is money. And, here we are. We're fighting like hell. To your point, that we're expanding in relation to the fact that the threat is expanding as well. It shows that we're connecting with Canadians who have never, ever thought that the private system was ever better than ours. And that small minority that does usually has a financial interest.
I hear that. I think, when we're hearing horror stories of private healthcare, we're always turned south, as though there aren't stories like that already to be told here in Ontario. Peter, give us an idea. It seems like this idea that we're fighting against the slow privatization, but I don't think people are actually feeling the threat, and that's probably maybe they haven't had to pay for services just yet. What is the current status of private clinics in Ontario? How prevalent is private healthcare already here in the province? And you can touch on Canada as well, because we do have listeners
Sure.
coast to coast.
Well, my most familiar area is here in Ontario, but certainly I think your listeners would be familiar with that. Almost every jurisdiction, especially the ones with conservative governments, even though I say we're nonpartisan, it seems to be conservative governments of the day that are the most aggressive in pushing the agenda for a private system or their involvement in public health care at least. And so, yeah, there's Quebec. There was the Chuli case a decade ago, which threatened that it's unconstitutional to not allow a patient to get access to necessary care in a timely manner if they can afford to circumvent the public queue. Uh, Dr. Brian Day, now out of British Columbia, has got a court challenge that it bases it on the same constitutional argument that you should be able to pay privately to access necessary care if you can afford to do that. And it goes on and on. We have independent health facilities that were ironically brought in by Deb Matthews and the Wynne administration here in Ontario in just about 5-6 years ago, and it was a means of actually attempting to circumvent the ban on private hospitals that had been established in Ontario since 1973. So all of these things have culminated now, and they're seemingly entrenched, although I believe with a strong, firm public pushback that we can reverse the way the tide is shifted right now. Now, the dilemma with these private facilities is that they do nothing to solve the issues that are our problems at hand. Number one, enormous collapse of staffing throughout all Canadian jurisdictions, and in Ontario, especially acute. We already do not service our public service infrastructure any better than any other Canadian jurisdiction. So imagine the largest province, largest population, and per capita, we do not fund hospitals any better than any other jurisdiction, not a territory, not a province the size of PEI. We are the bottom. And now we're also pretending like somehow we're going to miraculously bring in another tier of healthcare providers to relieve the pressures on the public system through a private provider in a private surgery without really advocating the fact that, or admitting the fact that these are the very same surgeons that work in our public hospitals but can't get OR time because there's no funding for the public side. We have it apparently aplenty for the private side. That's our public dollars. We're paying privately when we could have been funneling all these resources into the public system, and there wouldn't be any profit taking. We just go 24/7. And there are healthcare workers willing to do that, but they're not getting the support from our government.
I mean, that's often the myth that's sold with a lot of privatization, right? Is that it's a cost saving measure. But, there's the private agencies that we end up paying even more to, or, the fact that we've lost control over some of these public services, that is costly. COVID, defunding our healthcare, that became actually more costly, not just in lives, but in actual dollar amounts. So, and Peter, is it not right though that like for 30 years really we have seen this, if we're called the blueprints of disruption, this the blueprint of neoliberalism, where consistent defunding for the purpose of eventual privatization, right? Gradual privatization. And we're, advocates for education are saying a very similar story where you make it just so bad that you can't but help contemplate paying for a private education or private surgery. My husband right now has no hope of getting the surgery he needs to make his back better. There's all sorts of wait lists and different criteria. And I thought for myself, I felt pity for us because I thought if I were rich, I could help him. Right. So our minds do go there. Right. But it's because the public system has failed us, not because it doesn't work, though. Right. It's not because it doesn't work that the idea of public health care, free health care paid by tax dollars, doesn't work. It's they have destroyed it for this purpose. That must have been you've been doing this a long time. That must be hard for you to watch.
I literally have been there from the days of the Romano Commission in the early 2000s. And at that time, there was the considerable threat because the federal government was like in a headlong flight from supporting the transfers necessary to the provinces to fund the universal healthcare system. And Romano's commission to this day remains the most inclusive, comprehensive review of what Canadians wanted out of their healthcare system. And it was fundamentally a values based report. And he said so. It's not a partisan issue to say that all Canadians believe in the value of equity and accessibility for someone who needs healthcare. And it's not based on whether they can pay to get ahead of the line. So this is the fundamental principle that drives all of us when we're talking about defending Medicare. It's totally, outrageous that we can still end up with these failed leaders who are not representative of the public will in positions of government decision making. And that's not that the system has failed us, it's the leaders that have failed us. Give the resources to the public healthcare system, and it is the same wonder that we thought it would be 60 years ago. But of course, now, you said it. The playbook is break it, pretend that you have to bring in the private sector to help mend it, And then unfortunately, you've lost your public system eventually because the resources will all flow into the coffers of the private sector.
So we know this impact won't be on the people making these decisions, right? We're generally governed by very wealthy people. Not only are they paid very well, but they usually get where they are because they're wealthy. That's another episode altogether, I suppose. But this is going to impact already marginalized people, right? Typically, that means people in poverty or struggling. And that can be for a variety of reasons, right? What As we go down this path, I can't help but think right now the big discussion is on the long-term care homes and what the cost-cutting measures mean for disabled folks that require the long-term care, and how I do see people making noise, right? I know that there's advocates, but they're the same advocates that are always kind of doing this defending of the health care. I'm astonished that we are not seeing more action on this right now, especially here in Ontario. Let's break this down to a two-parter. One, how else can you tell us like this is going to really impact marginalized people? In a reality sense, not just like they'll have lesser health care, but let's kind of dive into that. And then I'd like to explore also what this impact would be on the healthcare system itself, right? So,
Oh yeah. Well, our long-term care story is definitely a one with hills and valleys. And to put it in a historical context, certainly in the Ontario situation, before the Harris government, the conservative government of the 90s to early 2000s, uh, long-term care was predominantly a nonprofit sector. Um, and there were probably more municipal homes, which are regarded definitely as amongst the best when it comes to plowing resources and human resources back into the care provided. Certainly, we discovered that during the pandemic, they ended up being the shining stars in what was an overly gloomy look when some of these private providers had to have the military occupy them just so that people could be saved. That alone, should have been a trigger for Canadians to go listen, and most Canadians did, by the way. I mean, it's the Trudeau government that failed us there. They could have said, this is the time to now make a national long-term care act that's fully funded publicly and drive these for-profits out.
because they know as good as we do that memory is short, right?
Yeah,
So you're saying like they should have capitalized on that clear understanding we had when we were in the first few waves of COVID, where folks were dying in larger numbers in private facilities, like Peter's talking about. And yeah, we all tweeted about it, but no legislation was passed to kind of prevent this from happening province to province or prevent it from happening again.
exactly. They threw it
Yeah.
back into the private accreditation system. And honestly, we all know every facility in the country is accredited, but it didn't save one life. So it's just nonsense to, I think the feds put about 3 billion commitment into it, and that's a drop in the bucket, especially when they're quite happy to put in 24 billion into a pipeline. So we know, where's their priorities here. But that's a digression from the history here, and you know, to the un- unending shame of the Conservative Party of the 1990s. It's Mike Harris literally slashed and burned 10,000 hospital beds, chronic care beds, out of the system and opened the doors to the for-profit providers in long-term care, because this is what his whole strategy was to download patients who should have been in a chronic care hospital bed into a long-term care bed, which is only a third of the cost of a hospital bed, and of course, lower graduations of staffing. And this is now back in the 90s and early 2000s, remember? So we still had relatively good numbers of healthcare workers in the system. Um, but as it turns out later, we also learned that, Mr. Harris invested heavily into being on boards of directors of for profit long term care facilities and his family. And it's an
He's making
ongoing
good
debate.
money off of that.
Yeah. Oh, yeah. Like, if this had been a scandal in some other jurisdiction, like, how is this guy getting the Order of Ontario?
Because we keep electing capitalists, right? So like people think, oh, they're the premier, they're there to take care of us, they guide us. Like, like folks are really just still very naive. But in reality, they are capitalists just stepping out of their role for a moment to reshape our public sectors. Then they go right back into it, wealthier than when they started. So folks might know Mike Harris' story and get really enraged because it's enraging. So that is the premier of Ontario who now, makes millions of dollars off of the misery of folks in horribly run long-term care homes. But that is really the norm, Peter, right? Like healthcare, we can expect all cabinet members essentially from conservative governments to get really cushy private sector jobs when they come out. None of this has ever been done in our best interest. And you did mention conservative governments, but I am glad that you pointed out that liberal governments too here in Ontario and beyond have steadily defunded the system and Trudeau, you say, has done nothing to repair it. How bad does it have to get? Like, what do you imagine? We have 4 years of Ford here. We're in year one of this his second term that let's not even go how he got that second term. But if he's already doing this in year one, what can we expect after 4 years? What's your worst case scenario after 4 years if we don't fight back hard enough?
Well, you have to reflect on what's already happened uh, since the election campaigns. Like, the Ontario Health Coalition was about the only organization that put healthcare on the policy map during the election, which is kind of outrageous considering that
During a pandemic?
yeah, it's kind of like, how did we have to force traditional media outlets to actually even ask the questions? We had just gone through 4 years of a government that refused to even release its ministerial mandate letters, which is unheard of in its own right. And what did the media come up with? And it's certainly not what New Left has done, but it certainly is what traditional outlets are. They said there was no campaign issues. That is ridiculous. They became scribes of the Ontario Premier's office and said nothing because he wouldn't answer questions. Wouldn't that just say right away, bloody well, ask them the questions? They have to be asked.
The mandate letters that Peter's talking about that are secret, these are instructions from the premier to his cabinet ministers on his vision, what he expects them to do in their jobs. And so we don't know what he has told the health minister, the education minister, what his plans are. So that's, I just wanted to add a little bit of back information for folks who may not understand just how egregious that is for us to not have those mandate letters and for the press not to demand them.
Yeah, and I have to tell you, this is the most undemocratic provincial government in my lifetime, and if not in all modern history. That the fact that they are ramming through a bill today, like literally this week coming, Bill 7 is what it's called here in Ontario, and it's going to obliterate the right of consent for a hospital patient who is waiting for a long-term care bed or otherwise, quite frankly, and obliterate that so that they can free up beds for whatever surge in the next wave of COVID may be, or trauma, or anything else, which actually doesn't do anything for the staffing at all. It just means we're going to push you into a private facility, which might be one of the worst providers of care in the entire province, so that we free up a bed for someone younger. It's ageism here too, right? It's all of these factors coming to play, which happened throughout the pandemic. So you're old, you're expendable, we can just shove you aside. This government is not having debate on it, it's not having public consultations on it. That is what was handed to this government at that despicable election result, where 18% in Ontario dictated 100% of government policy. So we've got a lot of problems here. And that's part of that issue around, the long-term care private providers with their tentacles right through the Conservative Party of Ontario and right through the Premier's office. We have a revolving door for the Minister of Health, literally. Like, we've got this fourth one. We've had 4 years now of this dictatorial rule, probably, is what we're faced with. And that's, to your point, just what my fears are of what we're going to get in the next 4 years, when they can ram through a bill without even discussing it with the opposition party. I mean, it's unbelievable, and they're doing it at the behest of all of their cronies in the private sector.
I love how that's why I absolutely hate the tactic of groups demanding the resignation of a minister, because that is doing absolutely nothing. They all have the same mandate. It does not change with the personality. You're only allowing a facelift to occur to the public to get them to start back over, where you then have to discredit another minister. It should be the ideology behind what they're doing that folks should be challenging. And I think that's one of the downfalls of the opposition, frankly. I wouldn't even bother naming the minister. It doesn't really matter. It's all coming from capital. You could say Ford, but we really do need to help people understand that it isn't Ford is a bad person. He is, believe me, that what he's doing is awful and it will kill people. But Ford represents an ideology that won't be replaced, even if he were to leave today. Even if you were to vote him out today and put the Liberals back in, there's no guarantee. I want to go back to the impact, though. You did mention ageism. I just want to make a note that it's mostly ableism, though, because you don't go to a long-term care home because you are old. It's because you have disabilities that require attention or accommodations. And so what we're seeing is disabled folks are going to be on the front line of these cuts, right? They're now being viewed as just simply taking up beds, as though they don't deserve one of their own, right? That the care for disabled folks is just going to deteriorate, because we've seen such a disdain for disabled people across Ontario. With ODSP is just a great example. The services that we give, the social assistance that we give disabled people is legislated poverty. And so, that troubles me, because I don't think the public is acting with the urgency that they need. Perhaps maybe they're waiting until that's 4 years, so I see the political parties, they're all playing the election game, right? So they'll establish a new leader of all of our Ontario parties and get in position to beat him in 4 years. But let's talk about the generational impact that will already be felt from the cuts, right? Because we still feel Harris's cuts, right? You can still point to things and problems in the system from Harris's cuts that were never fixed, and that can't be fixed. I don't really know, but does that add to the urgency to not wait 4 years to really take up arms, metaphorically speaking?
Yeah, exactly. As I was pointing out there, like, this government, who really has no mandate to tamper with the healthcare system, is already making an all-out assault on long-term care patients and residents in the height of summer, and hoping that the population will not have their minds on any of this until it's too late. And, it's shameful that traditional media outlets aren't even raising more than just a sidebar about, yeah, and people won't have informed consent uh, for far less. And we could drift into that crazy world of the convoy and occupiers of Windsor and Ottawa. But I mean, they got up in arms over public health measures.
A mask, right? Being forced to wear a
Yeah,
mask.
like public health measures that help everyone, masks, vaccines, and yet I see not one of those convidiots out there now demonstrating about the right to consent, which is fundamental to their very argument. But that explains where they're coming from, really, isn't it? And, they're really the forces of conservatism. They're not the forces of the liberty they talk about. And so, yeah, it's going to happen this fast in his second term. And again, we don't even have the mandate letters from the first term. I can well imagine what the term of office is going to look like this time around. So, organizations like the Ontario Health Coalition are gaining traction because we're actually speaking out and being very public wherever we can. New Left, I thank you so much for getting my message in there. But there's so many more speakers that I know you can talk to about this. It's just face to face seems to be what's actually working. And in a pandemic, as all activists know, it was almost impossible to have those face to face meetings, except unless electronically through Zoom or something. And yet here we were in Ontario, London, Ontario. We doubled our membership at our London Health Coalition simply through something as simple as the technology of Zoom. It does get the word out. We can't be as visible as we'd like to. But let's face it, if a bunch of whack jobs and a convoy can bring this country to its knees, I think we, as the vast majority, can really do something here.
Well, and if we go back to that comment you made, where essentially it is a value of most folks, even if they are convidiots, which I do love that term. I had not heard that one before. They should also believe in public health care, right? They're the first people to talk about Canadian values. You've seen the trucks and the flags, right? So if that's not a quintessential, I'm using air quotes, people, Canadian values, because there are, in my opinion, no Canadian values. We all hold different values. But I think generally most folks believe if you're sick, you deserve care. And
Yeah. But we know that that's not where they're coming from.
no, but
And,
they should be
that was the
allies in this,
fault.
no? Like, it should be every
Yeah.
Canadian
Well,
taking to the streets to demand.
we had them. You know what? They had a simultaneous protest with us over in at the beginning of this year, January, and they did not intermingle with us. Not that we wanted them to, because we were celebrating healthcare workers, and they're unmasked and they're waving their flags, and you know, it. There was no sense of solidarity with them at all because they weren't listening to our message. They just wanted to talk about freedom. Freedom of what? Their selfish individual ways, because that's all they want. And the crossover with the influence they have in the police departments, they're touched. They were like treated with kid gloves. And you and I both know, and we've been protesting prior to COVID, there was an unbelievable police presence around any government institutions. And we're very peaceful. And yet these people were reckless. So, there's all kinds of layers, and we know that they're funded by the extreme right and also the conservative elements, the capitalist classes that are the really super rich, the Koch brothers in the US. It's like it all coalesces with that kind of nonsense, that libertarianism, that only your individual freedom matters and the rest of society doesn't count. Of course, that falls apart pretty fast when there's no one else looking after anyone. So yeah, it all goes through this, and Mr. Ford is a manifestation of that. And you've got it right. We can remove one and place the next widget in there. They're the same ideologues, and that's why the movement of the Health Coalition and all other social justice groups must work together. Indigenous peoples have been front and center in our work as well. They've been obviously in a second tier for their entire existence when it comes to healthcare provision. The marginalized communities of the homeless, the uh, disabled, you name it. Ableism is a very good point you made. Um, it's just unfathomable that a society that values so strongly equity and accessibility would actually allow this. And I think we all know the vast majority don't believe it, but we don't have a voice. So this is a real problem.
Let's talk about, getting that voice and what you guys are doing and what folks can do. So, you mentioned healthcare workers standing alongside healthcare workers. Just for a second, how are they doing?
Well, on the front lines right now, it's no fabrication to say that what you've been hearing is the imminent collapse of our public system. I have nursing staff who talk to me regularly about, how are we going to make it another day? In Ontario, and I do know also in some other provinces, we are forced with closures of emergency departments because there are not sufficient trained nursing staff to man them. I'll tell you this, my entire 40 years in healthcare, that's never happened. Our government is in flat out denial to say that, oh, yeah, this might happen now and again. When in our history did that ever happen before? Never. Under this guy's leadership or lack thereof, it's happening on a regular basis. There's a small town north of London, St. Mary's. They had their emerge department closed. It's only one hospital in the whole community. How do you close an emerge department? And then you have to go how many more kilometers to the next one that might be open? It's outrageous. And yet we have millions to give to private facilities that do nothing for our public welfare other than pad the bottom line for investors. Our priorities with these people are way off.
So this must have, like, we're hearing horror stories from nurses, and you say, they wonder how to go another day. Obviously, a lot are fleeing from the profession. What can health coalitions do to support these workers? Other than get Bill 124 repealed, how can we help them today? Like, what are you folks been doing? You hear standing alongside them outside during rallies, but what else?
Well, we certainly have kept our communications with them um, wide open. As myself, am a healthcare worker. It's been my honor to be part of this organization, and it's so with the healthcare workers. It predominantly it's a female workforce. It is a unionized, heavily unionized, so that's a very good bonus because they already have an organized voice when it comes to their professional demands. So we more are on the political side of saying, to the government, because we can advocate to any government in power through our lens of being nonpartisan that, listen, this makes sense not to have this kind of legislation. Problem in Ontario is, and possibly in the other jurisdictions here, that you have governments that don't listen. And if you're locked out of the system, uh, they definitely have made their choices. And for us, we're going to probably have to take our tactics up a notch. And now the public health measures have virtually been obliterated. We'll be able to be more present in the public eye. So getting back to your point about the healthcare workers, literally we have to speak for them in most instances. There's too few of them. They cannot join on a picket line. They can't be going public about what they know without threat of losing their work and livelihood. So ours is the one that we speak for them as much as we possibly can. So they, the ones that are retired, have joined us in droves, and we're always strategizing together. And the ones that cannot still feed us the information of what's really happening on the inside. And we're the blowhorn that gets it out into the public. So, it's probably more important to know that we're aligning ourselves with so many other social justice groups too. Uh, for instance, the labor, or should I say, labor councils, as well as the uh, legal aid associations that are out there. I certainly know a friend of yours and mine that we both worked in legal aid together, and how we've come full circle here is pretty well a testament that social justice activists pretty well have the same agendas and thoughts. And so, you know, as well as Fair Vote Canada, I'll give them a plug too, because we all see the progressive voice is being diminished with a very poor electoral system. And there's no way there should be a government in Queen's Park like Mr. Ford's with only 18% of the vote. That's nonsense.
So, one of my next questions you've already answered because I want to know, you seem structured to give information and a voice speaking to politicians, right? So they make the right decisions. My question was, do they listen? The answer was no.
Not
You
right
talk,
now,
not right now.
because that
Fair
is the
enough.
nature of an autocratic regime, right?
Yeah, and don't feel personally slighted, right? We know he's not listening to really any female-led sector or many labor groups, except their friends. Maybe Lyuna has actually even called for Bill 124 to be repealed. I saw that this morning. So, my advice to Lyuna is maybe don't back the Ford government in the next election, and you won't have to issue those statements, friends. But, I was glad
Yeah.
to see that. But let's go. So they're not listening to you. You need the public to listen to you. Labor's on your side, which is let's do this. How are you going to be heard above all this noise? How are you folks going to get people who are tired and exhausted? A lot of us are out of work to get up and do something about this. What's your job right now, Peter?
Yeah. Well, certainly getting the information out, the clear facts of what is actually happening. Like, I don't even know how many Ontarians know that this Bill 7 is literally steamrolling resident and patient rights until they find themselves in the situation, of course. So it's this nitty gritty kind of deep dive into the politics at Queen's Park that we're very good at. Uh, our biggest challenge, and we're thrilled that New Left exists. It didn't prior to the pandemic, and that kind of helps when you have more media options. And social media, it is kind of a hit and miss affair. Certainly, a lot of people just tend to listen to what they want to listen to instead of open their eyes to other things. But social media also has provided us with the New Left. It's also given us other alternative sources of information. I feel very disheartened by the concentration of traditional media right now, because it is, as you've noted, Jessa, that it's ideology that's driving everything. And more billionaires who own all the means of conversation don't want to lean into anything that's too controversial against their own class's interests. So, here it's a bit of a Marxist lens, I suppose, I'm looking through right now. And I don't know how much I can give to the media as it's traditionally been to be able to be our sounding board. I certainly give a lot of credit to you and your audience, though. And all of our expansion has really come with the personal conversations we've been having. And that's literally, like what happened for Obama's first term of office. It was through that personal touch, the face to face, that they reached out to the vast majority. Because we already know we are the vast majority. We just are downbeaten. That's all.
So are you folks going to go door to door when you say face to face? That's the second time you've mentioned it. So is that how you're going to get to people beyond going, on podcasts and social media?
And that's what you have traditionally done during the prior run up to the election here in Ontario, kind of limited as to how much third party campaigning can do. And I suspect it's somewhat similar in other jurisdictions too. We were like the ones that are putting out the billboards and the signs and the lawn signs with the political messaging of don't privatize our healthcare. And otherwise, uh, again, what were we getting the drumbeat about from traditional media? Oh, the polls say that he's off to make another majority government, without any real substance to that. Like, why? Where did these polls come from? Who the hell answers that?
I've
Like, no
never
one
had
answers
them
a
call
phone.
me ever. But
I have, and I don't answer these phone calls because who does? You're bothered by them, right? But it's someone with an agenda, and it's someone who actually wants to talk. And boy, it sure looks like it's only 18% of the population for sure. And yet that was newsworthy enough to always be messaged, and not newsworthy enough to message that most residents in private care died in Ontario. That never got remessaged enough, and we're still living with those bloody consequences. And so I don't know what to make of the traditional formats, but back to your point about how we've done it, it's been the old-fashioned door knocking. We did that canvassing as if we're running an election campaign, but it was for the hearts and minds of Ontarians so that they were aware. And believe it, to this day, we have our signage up throughout this province right to this day, because we know this war is not over. And the battle may have been lost, but we are going to be fighting this guy right through to the end of his second
well,
term.
this is a class war, so I'm glad to hear. Like, yeah, this work definitely isn't going to revolve around these 4-year election cycles because we clearly have no time for that. I mean, it's it must be exhausting though to just have to kind of put that message out there over and over again and wish for it to gain traction and for people to get upset enough. I think because in reality we know it has to get worse sometimes before folks will fight to make it better. How can you, without sharing any secrets, but how can you escalate your tactics to kind of spark a little bit more in people before it's too late? And let me give you a little backgrounder because a lot of my listeners, myself included, really want to see the power of labor. So I do get excited when I hear that they back you because I feel like we're looking for work stoppages. We're looking for something really massive that can't be ignored. And I don't know, if we've hit the critical mass in terms of public awareness and anger. That's maybe for a pollster to figure out. I don't really know, but I think like a lot of us are very frustrated and we want to know what those escalating tactics can be. Because yeah, we went 4 years and we weren't really very successful in stopping any one of his initiatives except maybe expanding the greenbelt, and he's back at doing that now anyway. So what you know what can health coalitions, especially if you guys are working along so many other networks of social justice movements and with labor, what's your vision? If you could call all the shots, Peter, where would we be this weekend? Would we be surrounding Queen's Park?
Oh my gosh, we might as well have a permanent encampment and occupy it. A team convoy trucks really do that very well. So maybe we should be adopting some of those neat visual strategies,
Just
right?
minus the hot tub.
Um, yeah, exactly. Um, so it isn't like we haven't traditionally done that either, frankly. Like, how many times have we've all marched on to Queen's Park in Ontario and various other provincial capitals to demand, what's just and fair. Um, but it is with the labor movement, they are one of the prime um, partners within the Health Coalition. So, they sit on the Ontario Health Coalition's board. So they have a decision-making role there, as well as on the federal Canadian Health Coalition board. Um, our dilemma, it isn't like they don't agree with our vision or anything. It's just organized labor itself is so divided. And this is, a politics of labor that we are not involved with. So we can't like dictate to them how things need to go. They are often the most organized element in the left part of progressive society. So that's why they're so important to all of us. We pushed for over 15 years for a very strong, united front stand, such as Days of Action in Ontario against Mike Harris, and which would have been a general strike. That's constantly the word around, is that why haven't we done a general strike? That usually brings all kinds of governments, regardless how autocratic, to their knees. But I'm not getting the sense of that unity, and that is a little disheartening. They agree with everything, but there's personalities involved. And I mean, this show isn't about picking on why can't organized labor get organized. It's just we're doing our utmost to provide the information. They may provide the backing and the manpower in whatever instances they can. But meanwhile, we're going to do the visual things. We're going to have the demonstrations specific to healthcare, and a massive workforce that is in the public sector is behind this too. Perhaps those unions will then decide that they'll do this without the blessing of the overall body. All this is going on behind the scenes, but to this point, unfortunately, there's not been some trigger that's caused them to say we've had enough and we're going to shut the province down.
That's so frustrating because, like, I'm sitting here trying to imagine that, when you say trigger, I'm like, okay, so what could it be? Could it be, kids dying from a preventable infection? Is it nurses leaving the profession en masse? Is it ERs closing across the province? Like, what then?
Tens of thousands of deaths in profit-making
What
homes,
then?
shifting billions of dollars of public money to private investors. Like, what the hell does this country need to do to finally say enough is enough?
Because it's already a sector, sometimes often like something absolutely horrid has to happen, right? And it usually involves death, right? But this is a sector that, I guess deals with death every day. Have we become immune to the idea that people are expendable? Like, is that where, because COVID kind of gave that feel, right? Where we were clearly, other cuts, a little more nuanced, right? When you cut legal aid, people could die, but you have to do that little dance around to explain it. But like here, we literally saw dollars cut and people died, like as a direct result, and still nothing. So, I mean, a group of folks about a year ago, we started the Ontario Coalition Against Ford. Really impromptu. It was a knee-jerk reaction, really, to Ford's lack of measures. But when he went to the Attorney General to start charging people for being out and about, when he was still sending people to work and yada yada. And we got many, many people to sign this open letter. And it was a letter to the leaders of the Ontario NDP and to the OFL, begging them to start to work together to initiate some sort of work stoppage. And it was sent to every single MPP. It was sent to the leader by everyone who signed it, as well as, riding associations. 3 locals signed on to it and tried to bring it forth to the larger parent union. And literally, like, no one responded to this letter. Nobody. Even within the NDP, we're talking about 800 Ontario NDP members, 12 full riding associations out of the 122, and not one MPP or anyone from that party even said, thank you for trying. This is why we can't do that. It was just flat out ignored. So to hear from you, who have kind of the opposite perspective, like you're working with labor and all the kind of coalitions around the healthcare sector, and you're hearing the same thing, this real hesitancy towards anything that might be seen as militant or disruptive. This is Blueprints for Disruption. So you can clearly see I have a slant on tactics that we should be using. But Peter, that is so incredibly, I hope that things can change, but it is a critique that is valid amongst organized labor right now, and I think the left has to be open to making that critique, even though we have to spend our time defending the right to unions and the benefits of unions. We still can't criticize their leaders when we feel like they're not doing enough. And when it comes to all the rights that we have in Canada, like, we don't have a lot of economic rights at all. Public health care is really one of the only ones, and we have a right to public health care and education.
And that's being whittled away financially, and it's, the little brief history on Medicare is that initially it was supposed to be a 50-50 split. So, this is why we have this jurisdictional buck passing that we see always being played out. And, it never ever achieved a 50-50 split between the provinces and the federal government. And under Trudeau Sr., we came up with the Canada Health Act, but part of that act also limited how much money the federal government would fund provincial coffers, simply that, they didn't want to see a bottomless pit. But they weren't thinking in terms of the strings that we already have attached in the law to ensure that it's not spent on private profit. And this gets to the whole issues around, well, why aren't we enforcing what we already have? We have a Canada Health Act that literally, if the Trudeau II government ever wanted to enforce it, they just stopped transferring money to the provinces or sending money off to private health. And it's a very, very potent, very strong thing. But what do we hear? The provincial premiers just saying, we want more non-strings attached money. We want the money, no question. All of us are advocating for more money from the feds. They should be paying more. But we do want that also to be strictly for a universal public health care system. None of this giving it away to for-profits.
There's a similar argument that is made for securing abortion rights. There can be strings attached to the transfers that provinces have for our health care. But what a political nightmare that would be, to stop those transfers. And we can liken that to unions calling for strikes. So if ONA called for, the Ontario Nursing Association called for a strike, they would be blamed for the disruption in healthcare, not Ford, who has disrupted our healthcare as it is, and then pushed them to, if you stop listening to people, if you stop taking meetings, you continue to legislate against them, you can expect them to start seeking other avenues, right? Untraditional avenues. But it is a political nightmare because, as we know, politicians typically have one job, and that is to be reelected. That's the only thing that ends up mattering in their record at the end of the day, right? Is how long they held office for. So that is a huge barrier. So I guess public outreach becomes really important. You need folks, you need average Ontarians to start taking this as part of their responsibility as well, right? Not just the unions and not just your volunteers for the health coalitions, but every single one of us, right? So what let's try to end on a bit of a hopeful note, Peter, because, it is
Yeah,
a dire
I know.
situation.
We discuss this all the time. It's always doom scrolling when you're dealing with headlines on our democracy and our long-term care and our public health facilities. But you're absolutely right. I haven't done this for over 20 years just because I'm depressed and see no hope. Clearly, I'm an optimist. So the optimism I will share is that we are growing as an organization despite the barriers. So there is an outreach happening. I'm on a show that I wouldn't have ever been on not more than a year ago, probably. And yet, your show is going to go to far more ears than I could ever reach in London, Ontario. I know that once people, and that's the vast majority of us, grasp the dire situation, many are moved to act. Absolutely. I've gained so many more members in London just because of the last election cycle in Ontario that it took 10 years prior to get. And that was in one election cycle because the news is getting out. We cannot, predict the exigencies of an electoral system that 57% don't show up. Like that, we can't overcome that. That is not the fault of anyone who is out there fighting for the social justice in this province. It is literally a failing system that, for whatever reasons, people have lost the actual belief that the institutions we have are working. So maybe en masse, it just worked out that what's the point? We're going to deliver what's the point. Someone's going to do it. Good Lord, we have seen what the right can do from the most extreme fringes. Libertarianism has literally captured North American conservatives. That is such an extreme minority group, which now seems to hold so much political sway. I don't see why the heck not we can't do it too. We have means, we may not have the money, but we certainly have the people. And as we keep connecting with one another, sharing the word, Tommy Douglas did this in the 30s and 40s and 50s. And they didn't have the kind of broadcasting capacity you and I have today. I can broadcast from my own phone to tell the world what I think. Will they listen? Probably not, but they just might. And the odd one does. And then they get on board. And then they say, I want to help this way. I want to help that way. And I'm telling you, if Mr. Ford and his ideological bullies think that he's going to ram through unwanted highways, unwanted super mayors, he is going to have the biggest fight ever. Because thankfully, we now don't have mandates that prohibit us from gathering together. And it just might bring a few other people around to what's going on around us. We're not feeling any better off than we did before COVID. In fact, we feel worse. And there's no end in sight, except those people over there are saying there is a better way. What's their idea? And so on and so forth. And we're going to pull this off. We never gave up 60 years ago, and we're not going to give up now.
I applaud your optimism, Peter. I think that's a great note to kind of end our discussion on. That one, we do have to take ownership of it, but you are building. The folks that are fighting back, they are building, and clearly, as you can hear, they are determined. So, and also, what a great point to harken back to just how impossible public health care likely seemed when it first needed to be fought for. So even though the fight right now may seem very bleak, it has seemed bleak before, and we've persevered. So thank you so much for your time, Peter. Thank you for the work that the health coalitions are doing as well, like getting the word out. We will be sure to share many links in the show notes today not just from Peter's Health Coalition that he's a part of, but from a few across Canada. And we hope that you can kind of get in contact with them, see the work that they're doing, and also help amplify that. So once again, thank you so much for joining us, Peter. I love the kind of class analysis we were able to add to this discussion. That's very important to our audience and to myself. Much appreciated.
I can only thank you so much, Jessa, and all the fine work that New Left Radio is embarked upon. And I know your listeners are, truly supportive of the work that we do and all the other social justice advocates out there. So I'm so honored to have been on the show, and maybe we'll have another chat another day.
Oh, I think so. So if the urgency had not hit you before, it should now. We must push back without delay to protect public health care here in Canada. We must demand increased funding, demand better choices be made by our elected officials. Because right now, they've got the money to spend on war and oil and gas subsidies, on pipelines and police. One needs to only look at the tiny besieged island nation of Cuba and their world-class healthcare to understand it's all about deliberate choices at all levels and all stripes of Canadian politics. This fight against neoliberalism and the deadly austerity it brings with it will not happen at the ballot, though. And now you know these health coalitions aren't obscure organizations solely for healthcare professionals. They're everywhere, and they're made up of folks like you and I. And they need support. Most importantly, they need their supporters to be bold. Like in all things that we do, there is a team behind Blueprints of Disruption. I want to give a big thank you to our producers, Santiago, Hello Quintero, and Jay Woodruff. Our show is also made possible by the support of our listeners. So if you appreciate our content and would like to become a patron, please visit us at www.patreon.com/BP of Disruption. So if you know of any work that should be amplified or want to provide feedback of our show, please reach out to us on Twitter at BP of Disruption. Blueprints of Disruption is a project of New Left Media, an independent employee-owned company.